Treatment of refractive error is usually either with eyeglasses or with contact lenses or with the refractive surgery. For the eyeglasses or spectacles, usually this is the easiest and the safest way to correct most refractive errors. For spectacles, we have two types of lenses, either a sphere or cylinder. We use the sphere to correct myopia and hyperopia, and cylinder to correct astigmatism. For spherical lenses, the lens is either concave or convex. Concave lenses denoted as minus lenses or divergent lenses and used for correction of myopia, while convex lenses denoted as plus lenses or convergent lenses and used usually for correction of hyperopia as well as in presbyopia. Astigmatism is treated with cylindrical lenses. During prescription, usually include three numbers. The first number is the power of the spherical correction, which is either minus or plus, as we mentioned previously. The second number is the power of the cylindrical correction, which is either plus or minus. The third number is usually the axis of the cylinder. Some patients, those above 40 or 45, usually need an add correction, which is an additional power used as a near glasses, different second glasses. We call it add. Usually we use convex lenses, plus lenses. Presbyopia is type of hyperopia. That's why convex lenses is the usual treatment. The second option to correct refractive error beside glasses are contact lenses. Contact lenses, as you all know, are used either for cosmetic reasons, but you should know also we have the therapeutic and optical reasons. We use contact lenses to correct refractive error, and sometimes we have certain therapeutic indications we will mention later. As an advantage over glasses, contact lenses have certain advantages over glasses, and they have also certain disadvantages. As an advantage, contact lenses provide better peripheral vision. I mean with that, the glasses have peripheral rim, which is either thick, thin, according to the prescription, and this peripheral rim will give you less good vision, but contact lenses will provide you better peripheral vision. Secondly, contact lenses will not collect moisture. You don't have to clean them frequently from perspiration, from rain, from condensations of water, especially with face mask wearing. Contact lenses are more comfortable. In addition, patients who have certain sport, certain activity, they can also wear additional glasses or goggles over contact lens. Well, they can't do this with ordinary glasses. We have certain therapeutic and optical indications. As I mentioned previously, we use contact lenses to correct refractive error in keratoconus, and in anisoconia. Anisoconia, when the prescription of the right eye and the left eye are so different in large number of diopters that we cannot prescribe glasses, because there will be mismatch in magnification if we give glasses at this condition. While in keratoconus, in early stages, very early stages, glasses might be enough, but whenever the disease starts to manifest and the refractive error progresses more, glasses will become not adequate and we will need to wear contact lenses. In keratoconus, we have certain type of contact lenses which is specialized to correct the abnormal conical shape of the cornea. So it's the main mean to correct refractive error in keratoconus. And as I mentioned in anisoconia, one example of anisoconia is aphakia, and we will mention that in detail in lens lecture. These are some uses of contact lenses. Therapeutic uses include optical indications in addition to pain relief. I mean with optical indication to improve vision, and that in cases of anisoconia, which is unilateral aphakia when the lens is absent. Lens is the second most important part in the refractive system of the eye. 1/3 of the refraction comes from the lens. When the lens is absent in aphakia, the eye is very weak, and you will need to prescribe a higher degree of glasses for that eye to correct the vision, and that will produce what we call it, a phenomena we call it anisoconia. So to avoid anisoconia in unilateral aphakia, you will have to prescribe contact lenses and not glasses. Secondly, as an optical indication is keratoconus, where the cornea is very irregular. We have high degree of irregular astigmatism, glasses that cannot correct. So the only option to correct it is with specialized contact lens to reshape the cornea. And in cases of high myopia also it will produce a condition of anisoconia similar to unilateral aphakia. So whenever the refractive error is very high, or you have irregular astigmatism from scar or from keratoconus, you have to prescribe contact lens and not glasses. Secondly, as a therapeutic indication, it relieves pain in bullous keratopathy, where the cornea is full of fluid and bullae, and inflammatory keratitis, and in some sort of corneal epithelial erosion. Especially if the erosion is very large, we use certain type of contact lens to relieve pain and to promote healing. Secondly, promotion of corneal healing in traumatic erosions, as we mentioned. So in erosion, large erosions, we use contact lens for two reasons: to relieve pain and to promote healing. Also in chemical injury, when there is large epithelial defect. Post-refractive surgery, we always prescribe contact lenses for a week or 2 weeks. And after penetrating keratoplasty, even we use contact lenses. Here, contact lenses will promote healing. At the same time, they will decrease pain. They will help the patient to open and close their eyes comfortably until healing is sufficient. Another use of contact lens, either diagnostic or operative. We use them during diagnostic procedures, like during gonioscopy exam. Gonioscopy is a certain process. We use it to examine the anterior chamber angle using a specialized contact lens. We call it gonioscopy lens. This is one of the procedures done on a slit lamp examination. Operative uses even for goniotomy surgery. Goniotomy surgery is a specialized angle surgery. We use a specialized angle lens during this procedure, and for cosmetic use, which you all familiar with. Types of contact lenses. Usually contact lenses either soft, which is the most commonly used. Soft contact lenses used for cosmetic purpose and for refractive purposes, to promote healing, to relieve pain. So the most commonly used type is the soft contact lens, which is made up of silicone hydrogel material to promote oxygen penetration so the cornea can breathe, and it's very comfortable from the soft texture. We have another two types: the hard lenses and the rigid gas permeable lenses. Hard lenses usually made up from polymethyl methacrylate PMMA material. This is hard lenses used to correct the corneal irregularity. So it's used whenever we have corneal scar, irregular astigmatism, and in advanced cases of keratoconus, to reshape the cornea, because it's hard. It's of high optical quality. It's stable, lightweight, non-toxic, durable, and cheap. These are the characteristic features of hard lenses, but they are a little bit uncomfortable to wear, and they need a special procedure to put them on the eye. the patient have to be used to them because they are hard and you can feel them for a while before the eye is adapted to them. Rigid gas permeable lenses is a new modification of the heart. It is rigid and gas permeable at the same time to improve some of the discomfort of the hard lenses. So it's rigid lenses with oxygen permeability, unlike the hard one. The hard one are not oxygen permeable. We use either hard lenses or rigid gas permeable for the same conditions, which is corneal scar, irregular astigmatism, advanced cases of keratoconus, and so on, to reshape the cornea and to produce a new refractive surface for the eye to improve the high degrees of refractive error where cannot be corrected with the glasses or with soft contact lenses. While soft contact lenses used for lower degree of refractive error used for common ophthalmic conditions to improve healing, promote healing, improve pain, and so on. Complications of contact lens wear is very important for you as a doctor to know. Microbial keratitis is the most serious complication related to contact lens wear. Usually, as a risk factor, contact lens is considered the most important risk factor for microbial keratitis. So there is a link whenever your patient is wearing contact lenses, and especially in cases of poor hygiene or using tap water or improper cleaning solutions, you have to consider this patient if he presented with red painful eye that he has microbial keratitis until proven otherwise. Other possible complications is allergy. Usually you are introducing a foreign object on your eye, so there is high risk of allergy. Secondly, giant papillary conjunctivitis involving the superior palpebral or tarsal conjunctiva, where it becomes very inflamed and with giant papillae. Contact lens induced acute red eye. Eye is red and irritated and usually resolve with these complications: allergy, giant papillary conjunctivitis, contact lens induced acute red eye, resolved by discontinuing the use of contact lens and prescribing topical medications and follow-up. What about corneal infiltrate? Sometimes we have sterile corneal infiltrate related to contact lens use, but we can't consider the infiltrate sterile until we exclude the possible infection. If we have infiltrate, it's either keratitis or sterile infiltrate, which is related to inflammatory reaction. But the keratitis is the most common. So if there is infiltrate, we should exclude keratitis, then we think it is a sterile one. Dry eye, of course, there is a foreign object on your eye, there is disturbance in the tear film, and in addition to the allergy and inflammation, there will be dry eye syndrome. Neovascularization, because the contact lens, even if it is oxygen permeable, it will restrict the nutrient and oxygen transmissibility through the epithelium and the cornea, so there will be some sort of ischemia and irritation, which will demand a new vessel growth over the cornea, which is a problem. It causes red eye in addition to other medical issues related to the eye. The third option to correct refractive error, where you don't like contact lenses or glasses, you have either myopia, hyperopia, presbyopia, or astigmatism, is refractive eye surgery. Refractive eye surgery, we use excimer laser to reshape the curvature of the cornea and to ablate these optical imperfections. We call them refractive error. Excimer laser procedures are either LASIK or PRK. PRK is photorefractive keratectomy, and LASIK is another abrasion. LASIK procedure is an abbreviation for laser in situ keratomileusis. This is a procedure where a flap is created in the superficial surface of the cornea through the epithelium using microkeratome instrument, which is mechanical instrument, or we use femtosecond laser if we don't like using mechanical instrument. So either of these will create the flap. We will retract the flap and then we will treat the bed of the flap with excimer laser to reshape the cornea, removing tissue, and then we will replace the flap over the stromal bed treated with excimer laser. Well, in PRK photorefractive keratectomy, we use directly the excimer laser over the cornea to reshape it without creating a flap. That's the difference. Both of them used for common refractive errors, astigmatism, myopia, hyperopia. This is LASIK procedure, where the flap is created either mechanically or using femtosecond laser. Then the stromal bed is treated with excimer laser. Treatment usually will change the shape or the curvature of the cornea to produce the desired refractive effect. This is the PRK procedure, photorefractive keratectomy. We will remove the epithelium by scraping it. Usually the type of anesthesia used either in PRK or in LASIK is the same, which is topical drops. This is very enough. After removing the epithelium, the excimer laser is directed to the surface of the cornea to change the curvature, and bandage soft contact lenses applied to promote healing and decrease pain.